Up next on COVID's chopping block, Thanksgiving. Hospitals around the country typically have designated COVID-19 units. As a hospital emergency room physician, I am certainly not exempt from treating COVID-19 patients. We read and we hear about COVID-19 pandemic every day in the news. It's a topic of every conversation. Treating those who have suffered from COVID-19 firsthand on the front lines has opened my eyes to a different perspective. I've learned a lot about COVID-19, and today I'm here to share with you my experiences firsthand treating COVID-19 patients. We've rescheduled, postponed, and rearranged our lives for months due to COVID-19. Not only has COVID-19 jeopardized the health of many individuals, it's taking some of life's biggest moments from us. Celebrations such as weddings and graduations. Up next on COVID's chopping block, Thanksgiving. Living in COVID-19 world, should we be planning for a Thanksgiving dinner over Zoom? Today, I'm going to be discussing just how safe it is to have an in-person Thanksgiving dinner this year. What safety precautions can I take to ensure a safe and healthy Thanksgiving celebration during a pandemic? Hey everyone, I'm Dr. Jordan Wagner. I'm a board-certified emergency medicine physician, and on my show, I answer your urgent medical questions and clear up myths about certain deadly diseases. If you haven't already done so, please make sure you hit the subscribe button and turn your bell notifications on. That way you're instantly alerted when I post a new video. Oftentimes, Thanksgiving can be a stressful time for a lot of individuals, from planning to cooking, whether to discuss politics with Aunt Karen. The COVID-19 pandemic has thrown another wrench into the equation. It's whether it makes sense to gather for Thanksgiving, period. People congregating in small, poorly ventilated indoor spaces for extended period of time should be avoided during coronavirus pandemic, especially as COVID-19 cases rise across the country. Dr. Anthony Fauci has expressed concern that the upcoming holiday celebrations could further increase transmission rates of the novel coronavirus and is advising Americans to forego their big traditional Thanksgiving Day plans. COVID-19 is spread person to person through small particles or respiratory droplets that are produced when you cough, sneeze, or even breathe. That means a sloppy kiss on the cheek from grandma is a no-go. Keep in mind that even if no one is showing symptoms, they could be asymptomatic. The key to having a low-risk Thanksgiving is planning a low-key celebration. Keep your social gathering small. The safest way to go is to keep your celebration small by limiting the guest list to members of your own household. This means that the people that sleep under the same roof as you day to day. This is certainly not the year to be gathering with your mother's second cousin's daughter's aunt. One step beyond a guest list of people who sleep under the same roof as you would be including people outside your household. However, you want to make sure that guests that you are inviting are individuals whom you routinely interact with and share similar pandemic-related behaviors. Take precautions before gathering. Before inviting anyone into your home, it is imperative that you understand how they've been conducting themselves throughout the public health crisis. It's not the time to get together with a relative who has been vocal about not wearing a mask and not social distancing. You'll need to agree on some ground rules in the weeks leading up to your feast. To be really on the safe side, you would try to quarantine for 2 weeks before the day, or take as many precautions as practical. Rethink your tableware. Skip the fine china and go with disposables instead. According to a study that was published in the Journal of Clinical and Experimental Hepatology, it's recommended to use paper plates, napkins, and single-use utensils for Thanksgiving dinner. Coronavirus can live up to 3 days on plastic and stainless steel, 1 day on cardboard, and several hours on copper. Using disposables prevents multiple people from handling the dishes to bring them back to the kitchen and wash them. Anytime you can minimize how many people are touching the same surfaces, it's safer. Once dinner is finished, ask guests to dispose of their dinnerware in the trash or recycling bin, or collect dinnerware using gloves to prevent touching anything someone has put in their mouth or used to wipe their face. Assign a server. Although there is no evidence that COVID-19 can be transmitted through food, the virus could contaminate surfaces. Ask someone to serve the food to limit the number of people touching the dishes. You should also skip the buffet style of serving. The more people crowded around the table full of food, the higher the concentration of potentially infectious respiratory droplets. Host an outdoor gathering. The odds of transmitting COVID-19 are almost 19 times higher in indoor settings than outdoors. If the weather permits and is mild, move Thanksgiving dinner outdoors. Even outdoors, it's still important to maintain social distancing and wearing a mask when possible. It's a misconception that COVID-19 isn't spread outdoors. In fact, the perfect weather for an outdoor gathering, warm to cool air temperatures, low wind speed, and weak turbulence, can actually allow the virus to be airborne longer. Coronavirus aerosol particles can spread more than 1 mile in low wind conditions, which means other outdoor Thanksgiving celebrations could make you sick. The virus can linger for up to 3 hours in the air, according to research published in the New England Journal of Medicine. Even if there's no travel involved, gathering indoors with extended family and friends still can be risky, especially if there's an older or a high-risk person in your group. The Center for Disease Control and Prevention says that people 65 years or older are at high risk for getting severe cases of COVID-19. About 80% of the deaths in the United States from COVID-19 have been in people in this age group. Always practice social distancing. Skip the hugs and the handshakes and encourage social distancing. One suggestion that I read was placing chairs at least 6 feet apart, preferably outside, or setting up separate tables where members of the same household sit together. Don't have everybody cluster together around one big table. You want to avoid people crowding in mixed groups as much as possible. Wear masks. If your Thanksgiving dinner includes guests from outside your household, everyone should wear a mask when they're not seated at their table. Data comparing COVID-19 transmission before and after mask mandates took effect shows that the mandatory face coverings slowed the daily growth rate. It's a simple fact. You can find the links in the studies below in the description. Research found that the coronavirus deaths were lower in countries where the government policies favored wearing masks. Keep a basket with spare masks and hand sanitizer available for guests who forget their own supplies. Maybe even take temperatures at the door for an extra level of precaution. This year, Thanksgiving will be a bit different, but that doesn't mean we can't celebrate and still have our family get-togethers. While you might embrace the idea of choosing your Thanksgiving dinner guests judiciously, there are no guarantees. It is impossible for even small, well-acquainted groups of people who know each other's COVID-19 status definitively. People can get themselves tested ahead of time, of course, but a test is only negative at the time that you're tested, and rapid tests aren't always accurate. Many of the COVID-19 clusters that have popped up recently have resulted from small group gatherings of well-acquainted people who weren't wearing their masks. Something else to consider about Thanksgiving celebrations is that they are often intergenerational. All right, that's been a quick pandemic Thanksgiving conversation with me, Dr. Wagner. Let me know in the comments if you have any other medical questions that you would like me to answer. Hit me up on Facebook, Instagram, or Twitter. I'll be sure to respond to you there as well. And as always, make sure you subscribe and turn your bell notifications on. Thank you so much for watching. Stay healthy, my friends.